Afternoon. Welcome in. Today is Tuesday's rehab topic. I'm Amanda, founder of Sober and Beyond. Tuesdays, let me say that. And on Tuesday, I come on YouTube live and I share a topic with you. This Tuesday's topic is relationship dynamics. It's really important to be able to identify and actively participate in healthy relationships. How does that help our loved ones with addictions? As they start reintegrating into the world, they have to be able to decipher who in their life is facilitating this new version of themselves and who is perpetuating the old version. They have to also practice all these new skills that they're learning as it pertains to relationships and knowing which relationships they should nourish versus which relationships they need to distance themselves from. You're the loved ones of addicts. How does that help you, or how does this pertain to you? Well, we participate in relationships. It's not one-sided. It's important for the loved ones to understand relationship dynamics so that they too can analyze relationships and their own behaviors and really address what's serving me and what's not serving me, what's helpful, what's harmful. And as you know, looking at ourselves in the mirror is not easy. It's very uncomfortable, but bringing that awareness so that we can be empowered in our lives and be very particular about who we're engaging in relationships with and to what degree, because there's a very big difference between the person that maybe your partner or spouse versus an acquaintance at work, different degrees of access and different dynamics. Okay, so as you know, I have the paper that I use in the group. And let's see, where should we begin? Addiction is part of learned behavior. The number one factor to addiction is environment. Number one, beyond anything else. Even if you are genetically predisposed to addiction, that doesn't mean anything. You know what means something? Environment. And part of environment includes the people that we are near, the people we let into our world. And addiction really gets established. It's because it's a way to cope with pain, stress, trauma, or even relationship dynamics. Yes, it's unhealthy, but it was implemented as an adaptive survival tactic, because that's essentially all we're trying to do. Whereas people were programmed to survive. And when we take children who are a blank slate and have to be programmed, when we program into them dysfunction or trauma or chaos, they are going to implement strategies that are similar to that. How can I survive the dysfunction? Well, I have to learn to be dysfunctional in certain manners. Some of the factors in these unhealthy relationships where addiction really stems from or flourishes is emotional neglect, traumatic events. It could be one traumatic event, and it could also be circumstantial events, cumulative events. Insecure attachment, if a parent has insecure attachment styles. And also, if there's a lack of healthy role models or healthy roles within the family. As you remember, we discussed a few weeks ago the particular roles that are present in homes with addiction. So if those roles, because those roles occur before the addiction. So if those roles were dysfunctional, that's part of it. As it pertains to relapsing, most people who relapse, I have to say, it's not just about the substance. Its rooted cause could include toxic relationships. You're in this cycle of dysfunction, highs and lows. It could be loneliness, stress, emotional chaos. That's a big one that relates to relapse. And people pleasing or conflict avoidance. All of those things contribute to relapse and relapse risk. And as you see, a lot of that has to do with relationships, toxic, loneliness, chaos, people pleasing. All of those behaviors are connected to our relationships. With recovery, it's not just about stopping the substance. You really have to change everything about your life when you're in recovery and you're sober, and your entire life has to be different. This includes our relationships. And that's why you'll see a lot of people, there's a lot of animosity when someone is newly in sobriety because there's this pushback. They have to essentially choose if they want to stay engaged in these old toxic relationship dynamics or if they want to elevate past them. And they're confronted with a lot of resistance in that. And I think as family members, we can get resentful about that. Looking at it from the family side, the family goes through an immense, they put into this experience immense amounts of resource, energy, emotion. There's a lot of pain and devastation when you love an addict. And family members, they invest huge amounts into this event of loving an addict. For then the addict to get clean and start to distance themselves or cut them off, that can make you very angry and resentful. Well, I was there at 1 o'clock in the morning when you were crying and desperate. I was the one who booked you in a rehab. I was the one who gave you food. And it's easy to focus on the what you have put into that relationship and then getting resentful and angry when they pull away and they kind of make you feel like, well, I don't need you anymore because I'm better. I want to say that it's not that they're leaving because they're better. They're leaving because the relationship doesn't serve them. That's the main thing. Second thing is, it's a little hard to say, but whatever you invest in a relationship, even if they ask for you to invest it, you chose to invest that. We have to take responsibility for ourselves. Yes, I was there for you at 1 in the morning because I chose to be. Yes, I fronted the money for 5 rehab stays because I chose to. Not because you're in debt and you owe me something, but because I'm choosing to. And that can be a little complicated, but I want us to start digesting it in that kind of a manner of empowering ourselves. I invested whatever I was willing to or chose to. And we all have to make choices for ourselves. So if I'm choosing to invest in that relationship and that person is choosing not to, I can't do anything about that. They're choosing not to. I chose to, they chose not. Same when an addict is in recovery and they have to make choices about who's in their life. It feels very personal. How can it not? But if they had things perfect the way they would prefer them, they would not have to distance themselves from you. And for whatever reason, they feel like they need to. And that's the choice that they're allowed to make for themselves. Okay, let's see. I want us to start thinking about what's a healthy relationship because If we come from dysfunction, we don't know what that is. Healthy seems scary, it's unknown, it might seem cold or mean, and it can also feel wrong. I get that a lot where addicts tend to not understand how to have a healthy relationship and say we're practicing boundaries, they feel very guilty for having boundaries. Even though it's weird if you don't have a boundary. It's really strange for you not to have boundaries in a relationship. For them, it feels really uncomfortable to have them. And they feel like they're being cold or dismissive, or they're not showing their love, or they're not being compassionate by having boundaries. And that for that reason, it's imperative that we start highlighting, well, what does that look like? And how can we introduce that incrementally so we slowly start to adapt or can slowly digest that discomfort? In a healthy relationship, both people, and this is important because relationships are dual. And by relationship, I am meaning all types of relationships. You have a relationship with your coworkers, your boss, your friends, it could be housemates, eh, also romantic partners, but expanding on anyone we're continuously in some kind of dynamic with. Both people, they need to feel safe, respected, and capable of emotional regulation. Neither person is the controller, the rescuer, and neither person is losing themselves in the relationship, which is what we see a lot in codependency, where they really don't have a separate identity. They assume to be one. Problems in the relationship, it could be independent problems, it could be problems in the dynamic itself. They are addressed. We aren't ignoring them. We aren't avoiding them. And we also aren't letting them build so that there's an eventual explosion. The 5 pillars of a healthy relationship. Safety. Number 1, we have to be safe. And that's also being emotionally safe as well as physically. There's not intimidation. There's not threats. There's not manipulation. There's not emotional punishment. I'm not walking on eggshells so I don't upset you. There has to be safe. Second one, see if I can get that. There we go. Respect. As I mentioned, boundaries. Boundaries must be communicated and honored to the best of our ability. Of course, you know your boundaries are your responsibility. And if we're in a relationship that I value, I'll try my best. We'll try our best. That's it. But boundaries should be respected. We should be allowed to have differences. This seems to be controversial today that people are kind of like, you're on that side, I'm on this side. I hate you, which I think is crazy. We're different. We should be different. We should also be allowed to be different. And you should also have friends that are different. You should have relationships with people who are different than you. Okay. I think PSA, we're supposed to be different. Right? Think about how many types of trees or flowers or animals there are in nature. We are supposed to be different. So allow that, nourish that. Hey, I don't watch sports, but my partner loves sports. Let them have their sports. A lot of people might try to sway their partner away from sports or make them feel guilty. Oh, every Sunday, all you do is watch football. Let them have their things. And you should also be allowed to have your things. Maybe every Sunday you do your thing. Allowing differences is very important in relationships. Also, along with respect is we're not belittling each other, we're not mocking, and there aren't any power plays. Naturally, I think there might be this slight tendency to engage with power plays, and I think that does occur normally and is healthy, and that's fine as long as we're checking ourselves and it's not to an extreme. Everything that I'm talking about, we want to make sure it's balanced and not extreme. That's the goal. Number 3, consistency. We want to make sure our words match our actions. Affection is not being used as currency. That's a big one. And we choose stability over intensity. Yeah, it's exciting, it's invigorating, but it's not stable. We want to choose stable, dependable. Those are the good, consistent types of relationships we want to engage in. That being said, I mentioned earlier different types of relationships. Maybe you have an acquaintance that you go do crazy wild things with, and that's your invigoration. Fine. But we want to make sure that doesn't overrule us and that isn't our main focus is this hyper stimulation in a relationship. Number 4, accountability. Both people can admit or acknowledge when they are wrong. We're all wrong at some point or another. That's not a problem. That's normal, natural, and it's not going into the respect. We're not doing power plays. Oh, you're wrong, and now I'm more powerful than you. Look, we mess up, we acknowledge it, and then how do we mitigate it? Have those conversations. Also, under accountability would be that repairing after the conflict. We're able to resolve it and move on. And there's not any blaming or gaslighting. I think you might want to take some jabs at each other every now and again, but making sure, like I said, the relationship is not too skewed in one direction. The last one, number 5, interdependence. You want to engage in relationships. We, as humans, we need companionship and connection. However, we are not disappearing into those relationships or dissolving into them. We have to make sure we maintain our identity, our autonomy, and be independent, interdependent. As it pertains to sobriety, we want to make sure that addicts aren't overly relying on another person, especially depending on that person's mood or their output. That can skew our success rates for sobriety. We want secure and safe relationships. Why? Well, that's healthy, that's balanced, that's going to be the best for us. Healthy relationships, they also lower stress hormones, they reduce relapse risks, and they improve emotional regulation. It's my job to regulate myself, but under certain circumstances, that's going to be darn near impossible. That's where those relationships come into play and making sure that they're healthy. Let's see, emotional regulation, yes, as well as making us feel more connected to ourselves, to the world, to our partners, our friends. And that's going to also make us feel more supported just in general in life. We want to feel supported by those around us. We mentioned some healthy relationship factors. I also want to touch on unhealthy. If we talk about one, we got to talk about the other. Unhealthy relationship dynamics. These aren't in any kind of order, but number 1 is very fitting as we're talking about addiction, and that's codependency. There's a huge, huge rate of codependency linked with addiction. It's huge. Most addicts that I know or engage with or work with, they have some type of codependency relationship happening in their lives. Majority of them, to some extent. Some are much more extreme than others, but to some extent. And how I think about codependency is two heads on one body, is how I visualize that. It's just two people trying to merge into one, and it's conducted in a very unhealthy way where one person overly gives and the other person overly takes, almost like they can't be without each other. My sister had an addiction and she had a very extreme codependent relationship with a family member. I didn't understand codependency at the time, and I knew the relationship was weird, but I didn't investigate any further. And I probably did that by design. I chose the ignorance. However, that relationship created this environment where she didn't want to be far from this person. Like, physically, she did not want to be more than 20 minutes away from this person. Or when this person was home, she had to rush and get home and make sure she was there. It was very, very odd and uncomfortable at times to watch. But she in this relationship was giving a lot and the other person was the taker. The other person orchestrated environments where she was belittled and always in need, and an environment where her addiction could thrive. And that was by design. The environment helped her be an addict so that this person could have better control over her. And that's actually very common with addicts, especially when they're trying to recover. There will tend to be one family member who tries to stop that change simply because they benefit when the person is in addiction. And I will say that this person, this family member, I saw this person cry in front of me, begging for my sister to get clean, but then go and commit actions that helped her relapse, helped her to sustain her addiction. The words did not align with the action, unfortunately. And that's what you'll see is, and that's what's very confusing for addicts. It'll be the people who are crying and begging them to get help are the same people who are going to try to set them up and get them to relapse. Unfortunately, that's just how it is. And I don't say that to, y'all know me, I don't demonize or blame or shame. That is not what I'm about. But what I am about is bringing awareness to ourselves, our behaviors, our actions, and taking accountability for that. Once we do that, then we can make corrective action. But unless we're willing to reflect and bring awareness, there is no change. Just like an addict, right? What's the first step? The first step is admitting there's a problem, and then they can make corrective actions. It's the same with awareness and our behaviors. We have to have that awareness and be willing to go there with ourselves before the change. Okay, right. Codependency. How does that kind of look? A lot of fixing, rescuing, attempting to manage other people or manipulate people, maybe put them in a weakened position so that they're dependent on you. That's what the whole relationship dynamic is. The loss of your identity in this relationship, most of the time it's the giver who's going to lose their identity and the taker becomes more empowered. And we're going to be staying in these relationships even though they're harmful, even though they're not satisfying or gratifying or going anywhere, because we don't want to be alone, because we feel needed. We have a role in this relationship, and that feels good. One of the troubling things about codependency is that there's this link of this physiological sensation where, especially as pertains to enabling and self-sacrificing, where the reward pathways in our brain, they get activated when we're engaging in these behaviors, in these relationships, and we get rewarded by being in the relationships. And it mimics the way addiction behaves in the brain. And that's kind of one of the reasons why addiction and codependency is so heavily linked, is because it's a very similar experience in the brain. And problematic behaviors in these relationships, they're reinforced through that reward that we're getting in our brain, that stimulation of the neural circuits. These results in emotional highs and lows in these relationships, these cycles of conflict and resolution. And this really reinforces the attachment, reinforces this almost addiction to the relationship. Okay. The second one I have is what are we talking about? Unhealthy relationship dynamics, some things that surface. So codependency, and now is manipulation. Manipulation it's so successful and it's so easy to implement. It really is very easy, and it can come off very soft and smooth, and we can sway people in the direction we want them to go and ultimately lead them down a path that we want them to go down, for better or for worse. If we're honest with ourselves, we've all manipulated others, and also have been on the receiving end of that, been manipulated. It can look like guilt, making someone feel guilty. After everything I've done for you, after everything you've put me through, so on and so forth. And this was a good comment that was brought up in the group when I said that, is that there is space for normal communication, and there is space for saying, hey, I'm investing too much in this relationship. To what extent is it healthy versus unhealthy? Because you should be able to communicate if you're feeling overextended. Most of the time, if you're feeling overextended, it's because you are overextending. It's got nothing to do with the other person. It really doesn't. There's nothing I can do to make you do anything. If you're doing too much in a relationship, it's all on you. And by expressing that exhaustion to the other person, sure, they'll hear you, but at the end of it, there's nothing they can actually do. It's your responsibility to pull back and ensure that you are behaving in a balanced manner. Other forms of manipulation include withholding affection. That's a big one. If you grew up in a house where you weren't loved, you were not taken care of, you were neglected, you had to perform for attention or any bit of love, we're going to perpetuate that as adults. And to whatever side of that you're going to be on, the withholder of the affection or the one who's begging for the affection, either way, these are very unhealthy dynamics that are dependent on others. I'm looking for you to fulfill this space that I have inside of me, this space that feels unloved, that was neglected, that was supposed to have been cherished by my parents, but wasn't. Seeking outside of ourselves to fulfill these needs will never get us anywhere. However, if that's what we're used to as children, we had to perform or we were constantly neglected, we're going to assume that we continue to conduct ourselves like that as adults. And we're going to get in relationships where people treat us that way because we think that's normal and that's how it should be. I'm supposed to prove myself to you. And then you give me a little droplet of love and then I'm running around trying to prove myself, trying to get my next droplet. That's going to be what we think is normal because that's what we've been programmed to believe. Other forms of manipulation include the silent treatment. I have to admit, this one I do. I do this one to the day. That's because I get overwhelmed and I can't always process my thoughts and I can't always identify my emotions. Or sometimes I don't want to say something mean. I'd rather not discuss it right now. I will go silent. And I'm not the type to just move on and then come back to it. I get stuck in my anger or my attitude or whatever's dwelling in my head where I can't just pretend it's fine and then go back and talk about it. I need silence and separation until I've mentally processed it and then we can talk about it. So that share that because sometimes that's how people function or they know how to function. Sometimes people need silence and they need space and then come back. But the trick is the coming back. We have to have a conversation about it. We can't just go silent and I do everything in my head and then in a few days I'm like, fuss it. But silent treatment can be used as a manipulation tactic. Also, playing the victim. And sometimes we do this because that's our role. That's how we get our attention. That's how we feel important is by being the victim. And we can also control behaviors by being a victim. Caveat to the manipulation. It is not evil. Okay. We have all done it. You do it. Even if you're a saint, you do it. And it might be in a very soft and subtle way, so much so that you're able to ignore the fact that you do it or deny that you do it. We all have done it or do it. It's not about being evil. Manipulation is a survival tactic, it's a technique. That's all it is. I'm trying to preserve or enforce betterment for myself, and I will orchestrate whatever needs to occur for my betterment. And it's important that we don't associate manipulation with evil because we all do it. And I don't want anyone associating themselves with evil. It's just a behavior that was out of survival. And we need to bring awareness to ourselves and our behaviors for that reason so that we aren't perpetuating any harmfulness into the world or with the people that we really care about. As it pertains to being in relationships with people, if we're having to control or sway or manipulate, we're forcing someone to be with us for whatever the reason is. We are maybe being fake so you don't abandon me. Maybe I'm overextending so that you give me my little droplet of love. By being unauthentic, I am being manipulative. So even though I'm in this relationship to fulfill my needs, and it's just me wanting to be loved, me wanting to have friends, to have a partner, to have someone next to me at night, I am manipulating. I'm being manipulative. And we have to also understand that engaging in these dysfunctional relationships, we are performing manipulation on the other person. The third unhealthy relationship behavioral aspect is validation seeking. This is very common and you'll see it online. It's everywhere. I don't even think I don't think you can go on socials for 20 seconds without seeing someone seeking validation. You'll see it a lot. The girls at the gym and how they're hiking up their pants. You could see everything. And they're looking around for attention or they want to get mad because you're looking. It's like, geez, girl, like, If you didn't have anything on display, everyone seems like nowadays, especially when we're on the internet, we're starving for validation and attention, and people are going to more extreme levels for that attention. I'm sure you can think of many examples off the top of your head of that. It's being very desperate, begging on your hands and knees, "Please love me, please like me, please tell me I'm worthy, I'm pretty, I'm this, I'm that." Those are all needs you're supposed to fulfill for yourself, by the way. If someone tells you you're pretty, yeah, thanks. But, like, I know. That's how it's supposed to be. I'm not supposed to get some thrill out of you liking me. I like me. I don't care if you like me. It's not supposed to be thrilling because the more we are seeking validation from others, the more we leave ourselves open to manipulation. It's very easy to spot someone who needs validation. And because it's so easy to spot that, it's very easy to manipulate them. You can get a lot. You can get a lot out of them from giving them just a little bit and just giving them exactly what they want to, because they'll show you what they want. But they need constant reassurance. It's this never ending game of need, very similar to when we're in addiction, constantly having to get my need, my next fix, the next one, the next one. I get this one. Okay, feels good. Immediately, I got to go and seek the next one. It's the same exact cycle. Maybe your mood depends on your partner's approval could be. Could also be jealousy being framed as love. And this fear of independence. If we're seeking validation from others, we want them to want us. It's this dynamic that we need. And if they're independent, doing their own thing, fulfilling their own needs, that's not going to work for me. You're supposed to fulfill my needs. So there will be this discouragement from independence. External validation and seeking that, it's creates this environment of emotional addiction. It creates dependency. There's a lot of people-pleasing behaviors attached to it. And the fear of abandonment is extreme because if we're in a relationship and my whole worth is dependent on you and you threaten to leave me, my world is crashing down. I can't survive without you. Who is going to give me my validation? And that's where some tactics will start getting implemented. And also, the person threatening to leave, they're participating and they know what they're doing. And that threat is a form of emotional manipulation, and that's intentional. These types of behaviors, they almost always they stem from childhood that was neglectful childhood, and maybe the child was asked to perform in this cycle of sacrificing their personal needs and or chasing approval, all in this attempt to fulfill an internal void. What we know about dysfunctional relationships and excuse me, dysfunctional families is that they ensure that you are also dysfunctional. So you are discouraged from fulfilling your own needs because you're supposed to be dysfunctional and play our game. A lot of people, they never even learned how to fulfill their own needs because they were programmed to abandon themselves and neglect themselves very early on. If we don't do intentional work around this, we continue these behaviors as adults. That's why you see all these adults who are frothing at the mouth for some kind of validation. Let's see. They're very dependent. They're unable to be authentic, and they have very low self respect and self esteem. The next unhealthy dynamic includes high intensity, low stability. This, I think sometimes we call this love bombing, but it can be also in platonic friendship relationships. There's this fast attachment, these really big highs, really big lows, this kind of we're soulmates very early on. Drama is mistaken for passion or excitement. The problem is intensity does not equal intimacy. It's very emotionally volatile. There are frequent conflicts and often a lot of perceived threats. This creates high anxiety, insecurity, and unstable self-image. I'm sure you've been in relationships like that. It's by design. It is a form of manipulation. It's a strategy. They are trying to get something very quickly, and you'll see a lot of con artists. I love watching any shows about con artists. I find it fascinating because I could never, but I wish in another life I could. The gall to do those types of things. But if you watch con artists, especially the love scams, that's the play that they do. They get you hooked early and they get you hooked really quick and fast, and then you're in it. And the fifth thing that I have written here is avoidant or emotionally closed dynamics. That's very dysfunctional. Shutting down during conflicts or lack of communication, avoiding being vulnerable or avoiding being emotionally available, using anger. Here's a surprising one, using humor. Yes, the family role, the mascot. They grow up to be the comedian who can't take anything serious. Everything's a joke. You can't have a genuine conversation with a lot of those people if you've tried. They'll joke off everything. And that's just a strategy to keep you separated from them so they don't have to get too invested in you because they don't want to get hurt. It's just a strategy that they learn to implement. And also when someone withdraws to escape emotions, starts getting too serious, they just disappear and pull off. A lot of these behaviors, again, they stem from childhood where being emotional or expressing our emotions, it wasn't safe and you weren't able to do it. These types of relationships have a lot of inconsistency and the connections are superficial. Because if you're avoiding going too deep with someone, well, then our relationship is superficial. We really can't get too deep with each other. Being in relationships with people who are avoidant causes these cycles, emotional distance and confusion. You get a lot of mixed signals. There's that push and pull. It causes a lot of self doubt, loneliness, and also hypervigilance. You feel like you have to overcompensate or you have to feel like you have to clock their behavior before it comes on. Let's see. And that's we talked about more, but I'm kind of running out of time here for myself. But that's kind of what we talked about in the group. And it's really important as the loved ones of addicts to understand healthy relationship dynamics, but also what unhealthy is, because we can get those two things confused. What is healthy versus what is unhealthy? What is my role in the relationship? What is theirs? What is balanced? What does it look like when I'm overextended? How do I feel when I'm overextended? What am I seeking? What am I desperate for? Am I desperate? We have to divulge or dig really deep within ourselves and explore some of these sentiments to ensure that, fingers crossed, your loved one with an addiction recovers and they get on this path of betterment. My hope, the reason I talk about this, is that you too can come back together as healthy versions of yourself, healthier versions, and that you can remain in each other's lives. As you know, an addict, if they're sober and your relationship is toxic and it's threatening their sobriety, they're forced to make a choice. It's sobriety or you, because it can't be both. They have to choose. I want to talk about these things so that you can help facilitate sobriety and you can support that relationship, and you don't have to put them in this position where they choose between you and their sobriety. They can have both as long as we're all healthy and moving forward together. That's Tuesday's rehab topic. I'm Amanda Bork. Check me out on all the socials. Check out my website. Email me, message me, comment me, leave Q&As in the comment boxes of my videos. Come chat with me next Tuesday. Bye.